out in the marketing department. Now I'm in an operations role. So I've certainly seen a few different angles of how we work specifically for practices like yours and the value and difference that we can make. Just to give you a little bit of background about the company in case you're not familiar with us, we are the industry-leading physician connectivity platform. We help physicians spend less time on administrative work, especially in today's market. You're being pushed to do more with less, so we help you grow your practice and remain independent wherever possible. Some of our solutions are geared towards patient engagement and helping make those relationships stronger in an easier way for your practice. And then we also do a lot on the business efficiency front, so simplifying some of the redundant processes you might have running alongside your Amazing Charts EMR. Our experience with Amazing Charts specifically runs very deep. Amazing Charts was actually I think our very first partner, and the benefit there for Amazing Charts customers is that our integration was built around your workflows. Our features, from their initial builds to their enhancements, were all very much tied to our experience with Amazing Charts customers. We're able to help more than 3,500 providers using Amazing Charts right now, and the way that we help them is by providing a single point solution both for patient engagement and secure communication. Thinking through how we help them, so what types of things plague a small practice on a day-to-day basis? Well, it's certainly complicated to run the practice. At any given moment, you need to stay on top of the fax machine. Most of the practices we talk to are actually pretty concerned if their fax machine is not making noise at any given moment. You then need to grab those faxes and scan them into the chart, route them around the office for signatures. You also have patients coming in, obviously and hopefully, so that you're greeting the patients in the waiting room, getting their clipboard of paperwork, collecting co-pays, checking them in, checking them out after their appointments. And on the appointment side of things, you're also probably experiencing some amount of no-shows for the appointments. Or if you've recognized that this is a problem, maybe you're spending some administrative time making those calls to remind patients of their appointments and making those calls to track them down if they don't show up. There's also the concept of chasing down balances due, especially in the current state of things where you have high balance deductibles that people can't pay out of pocket up front all the time. So there's no opportunity for a payment plan in most small practices now, so you end up chasing those payments down on monthly intervals. So all of these different things happening at any given time. So if you had a really robust staff and one person to handle each and every one of those things, or a staff that had more than one set of arms, for instance, this would probably be an easy, manageable workflow on a day-to-day basis. But unfortunately, the practices we talk to are usually running a pretty tight ship with a slim crew. So you have a provider, sometimes a nurse practitioner, sometimes one administrative staff member greeting people at the front desk, and one nurse. But a lot of the practices we talk to have fewer than 5 people total to manage all of these activities on a day-to-day basis. So what Updox is able to do is help you by providing a suite of solutions from within one window that launches right from your Amazing Charts to help solve for some of these pains. On the communicating with providers front, we offer direct secure email. That also helps you attest for meaningfully stage 1 and 2. We also provide integrated electronic fax that makes it super simple to review faxes, mark them up, route them around the office, and then send them right into the chart. On the patient engagement side of things, we help by providing a secure patient portal to send and receive messages with patients. They can also submit forms electronically through there. They can request appointments that sync with your schedule from there. And then we can also engage them by sending them appointment reminders or targeted messaging by phone, text, and email to help them come to their appointments and stay engaged in their care. So this all-in-one solution not only helps from a practical standpoint in that we're solving all these individual problems, and otherwise you'd need point solutions for each of these problems, but we also help cut down on costs, because if you think about going the point solutions route for these individual pieces, you would end up having a base fee and a partner to get to know and a support system to get to know. So you'd have the costs associated with multiple systems, you'd have the windows associated with multiple systems, or if you opt not to go for those systems, you have the manual work that comes with handling all these processes, because at the end of the day, these are very much things that every practice needs to be keeping an eye on. So we do offer solutions in a few different tiers of service. Starting in 2015, we offered a free patient portal. This is kind of a bare bones, meaningful use portal. So what it allows you to do is exchange direct, secure messages with patients. So you could send them a message, they could respond to you. You also have the ability to export clinical summaries for meaningful use. You have the ability to leverage that website for promotion purposes because it is a searchable website. It's usually myupdox.com, or it's usually the name of your practice, and then .myupdox.com, which is Google searchable if you wanted to use that for your practice website. And again, the records, so exporting their clinical summaries. So a very bare bones approach to a portal. What it allows you to do is satisfy the meaningful use stage 2 requirements. Now, what some of our most successful customers have done, though, is taken that meaningful use requirement and kind of transcended the requirement part of it and used the solution as a tool to help their practice. And that's with our upgraded portal solution. And it really flows into a true universal inbox because you have multiple solutions flowing into that singular place rather than it just being a message box with patients. So in addition to the things that you get with the free secure or free portal through Amazing Charts, you would also get the enhanced portal, which would include integrated electronic fax, online scheduling that syncs with your calendar, patient payments, both in office, you'd have a swiper, and you could allow patients to pay you through the portal. We have Updox appointment reminders so that you can send phone, text, and email notifications, getting patients to their appointments, and they can even confirm or cancel from there. And then we also have Blast on-demand messaging, which is a really cool resource, either standalone from the reminders or in addition to them, because what we see a lot of people doing is leveraging targeted messaging to get no-shows or cancellations back on the schedule. In addition to that, you could use it to unexpected cancellations, and we'll get into that a bit further, and also for the purpose of securely messaging with your, sending a blast notification to contacts in your Rolodex. So blast kind of goes beyond just patients, and that you can send those phone, text, or email messages either to contacts in your Rolodex or patients or both. So some really exciting things that we're able to offer through that upgraded portal. A key point of that portal as well, whether you go the free route or the upgraded route, is that it launches directly from Amazing Charts since we are so tightly integrated. If you hit the secure button, it's going to launch this universal inbox that we're going to talk through today. Additionally, as your meaningful use partner for the portal, if you hop into the patient's chart, you'd be able to see like all of those meaningful use sections. So if you add an email address for a patient and then check the box to invite them to the portal, that's all kind of connecting to Updox as well. So we're very much integrated right within your system, and then where you'd access the messages, if there are responses, or if you use it for some of the additional features, would be through this secure window that launches right from Amazing Charts. We are web-based, so while we launch from the secure button, you can also get to us from your phone or from your home computer. Just by going to ui.myupdox.com, you'd have access to all of the same things, including your schedule. So we'll get into that a bit later with the scheduling portion, but just wanted to kind of draw attention to how you would get to Updox on a daily basis from your desk. Going a little bit more specific into your daily workflows and some of the problems that we try to help with, I wanted to jump into Faxing, which has kind of been a flagship for us. It was one of the first solutions that we provided to Amazing Charts customers, and the value is so simple in the time that you spend doing things. But I did want to go through kind of a step-by-step process of what faxing looks like for the practices that we speak with. If you're using a paper fax, you're sifting through the pile of paper on the fax machine, distributing, collecting signatures, walking to the fax machine, pushing the fax through, waiting for that transmission report, scanning it in, logging into Amazing Charts, finding the patient, go to Imported Items tab, and then upload. And in those 9 steps, it's super simple to get a document from your fax machine into the chart. So what we find, though, is that even if you go through these 9 steps to get it into the chart, practices often hear that a document, if you were to send it out, wouldn't have gone through. And I think, one second, my slides are a little misshaped here. Okay, I'll just skip through it. So Once that document gets into the chart, if you needed to go the other direction, you would be, again, bringing it back to paper to push through the fax machine. So from a pure steps perspective, the amount of time that you spend on this paper process, even outside of the costs that you're spending on this paper process, are certainly staggering. So what Updox does is simplifies it in just a few quick steps. So you would log into your Updox, either opening up a web browser and getting there or clicking the secure button within Amazing Charts. You would review the fax. You can actually break it apart page by page if you need to. You could edit or sign if you need to, and then you can send it. So what we make it really simple to do is send it to the chart, into the imported item section, into whatever section or subsection or category within that imported items tab that you want to send to. We also make it really easy for you to fax it back out, or if you needed to do both, you can actually fax and file a document from a single sending screen. Let me give you a look at that inbox. So the place that all of this workflow is taking place is the Updox Universal Inbox. So again, web-based, accessible anywhere with an internet connection, and this is where you would field those faxes. So on that step one, when you're reviewing a fax, this is where it would come in. This is kind of a simplified or collapsed view where it's going to give you a color-coded summary of the type of document, how many pages, if there's a title to it, if it's coming from a certain contact, it'll show you here. And then you can also open up these panels to see a little bit more detail. So if I expand the panel, it'll show me the thumbnail previews of each page in the fax. I can simply mouse over them to zoom in and kind of see what it is and determine my next steps. Or I can just grab the pages that I need and send them into the chart. We do understand, though, that oftentimes as documents are coming into Updox or into your fax machine, there's a need to apply a signature or fill out the paperwork or add a note before putting it into the chart or faxing back out. So what we've built there is a comprehensive editor, thinking through all the things that you might do if you had a pen to paper. So you have a freehand drawing tool, you have an eraser, you have a highlighter, you have a time and date stamp, a checkbox for paperwork. You have the ability to type notes, either numerical or text values. And then the real aha moment for providers is that we also have a one-click signature that you can apply on a document before sending it off. So again, if you think about the accessibility of Updox, if you had a doctor that was between offices on a certain day or out of the office and you needed a signature for something, you could send it to them inside of Updox. They could one-click sign it and send it back to you. So the one-click signature is definitely a provider-appreciated feature that we have. So from here, let's say you needed to file this document to the patient's chart. What we would do is hit the send button, and then in the sending screen, we've mimicked the fields that you would fill out inside of Amazing Charts. So you have a title, you have a category, you have the ability to either sign off while filing if you are the doctor, or you can create an inbox message in Amazing Charts for the doctor by checking this Notify Doctor button, or again, sign off if you are the doctor. And what happens here is that this is how you're directing it to that imported items tab inside of Amazing Charts. And it's as easy as that to send. From an audit trail perspective, once this gets to the chart, you'll also have that inside of imported items in Amazing Charts, and in the sent box of Updox, you'll be able to find this document, when it was filed, who it was filed by. So duplicate audit trails is another thing that we try to do for you. So from a workflow perspective, super simple, easy to follow. We try to be as intuitive as possible. Easy as email is what we typically use for faxing. But from coming at it from another angle, if you are the provider or running the business and you're a little bit less involved in the day-to-day pain that you might face managing faxes, you're probably wondering about the ROI of a solution like this. So oftentimes when we end up on the phone with practices and you ask what they're spending on faxing, they might tell you they're not spending anything, but what they haven't considered is how much it costs to buy a toner cartridge for an average brother fax, how much a case of paper would cost, how much they're spending on a fax line on a monthly basis, and that's even just the hard costs. You also have to consider the time that your staff is spending, your staff that you're probably paying well to take care of these things. So conservatively assuming 2 minutes per fax, it could take your staff as many as 55 hours to work through 5,000 pages. And from a price perspective, that could cost as much as $150 without even considering the cost of the time that your staff is spending. So Updox, as far as ROI on the fax position, we offer, I think, more than 200% when you consider the cost of what it would take to use Updox against the cost it would take for your staff to work through the paper process that most practices have. So even beyond just the day-to-day and quality of life improvements that we offer, we definitely offer a boost to that bottom line as well. The next feature that I wanted to talk about is our appointment reminders feature. So if you're thinking about what people were doing to remind patients of appointments before Updox kind of came to market with this reminder strategy, we either hear that they're not reminding, so maybe they're experiencing a lot of no-shows, maybe they're losing revenue on those no-shows, which we'll talk about numbers at the end of this section as well, and also the time lost that you could have spent doing other things around the office had you known that you had that opening in time. We also talk to a lot of practices that are manual reminding, so they have a person dedicated on the phone to making those calls. So they're pausing essentially from patient care then to hop on the phone and make those calls. Or if you're doing like a note cards type reminder situation, that's the same thing. You're stopping what you were kind of made to do and providing patient care to take care of some of these administrative burdens. So what Updox can offer for reminders is the ability to send text, phone call, or email messages. You can send up to 3 for each appointment, and our pricing structure is per appointment so that you're not penalized for sending more than one, and you're not penalized for sending more of a certain type. So sometimes you'll see a reminder solution that'll charge you by reminder message. Other times you'll see a reminder solution that charges you more for a certain type of message, because maybe phone calls and text messages are more impactful, but email is cheaper for the company to send, so they'll give you a cut rate on email reminders versus phone call and text. We just do a flat rate across appointments so that you can structure your reminder strategy to be as efficient and impactful as possible for your specific audience. And we're going to go over reporting at the end of this section too, because what we also make it easy for you to do is back out a month and see how your patients are responding to the strategy that you've put in place for reminders. We do offer the ability to automatically sync with the Amazing Chart schedule, and we also do proactive notifications of cancellations that are going to show up right inside of that universal inbox that we had shown a little bit earlier today. So it's right at the top of your mind if a patient does cancel, which they are able to do if you'd like them to. We have a lot of options and flexibility in terms of your reminder strategy. So if you wanted it to be like confirm or cancel, or if you just wanted them to be able to confirm, you have the ability to turn that on or off as well. Another benefit to Updox Reminders compared to some of the other vendors out there is that it's really easy to configure and make changes to. We'll let you type out the message that you want to include. We can do personalization tokens for you, and we'll even show you what it's going to look like, whether it's going to be a text message or a phone call. You could actually call yourself and listen to it, or you can review the text message so that when you're putting something in front of a patient, I know that when it's automated, you're always a little bit worried about what it feels like to receive that. You want to make sure that it's warm and conveying what you want. So the phone call lets you do that, and the text message preview allows you to see what the patient will see as well. As I had mentioned, if you do get a cancellation, if you elect to turn on the ability to cancel, you'll get those right at the top of your inbox, and they'll be labeled very clearly as appointment cancellation notifications so that you can hop on the phone or send them a quick portal message to get them re-engaged, or even load them onto a blast on-demand message list if you wanted to do that at the end of each day. As these reminders are going out, you'd be able to review them on a day-to-day basis by going to the reminders dashboard, which is also located inside of the universal inbox. It's going to give you either a daily, or you could do a date range, and it'll show you what appointments you have coming up for which provider and for which patient. And then you can even kind of filter your reviews. So if you wanted to look only at a certain provider schedule or a certain location schedule, if you wanted to look one day or a range, and then you also have the ability, once you've chosen the data set that you want to look at, you can kind of filter. So it's nice to look kind of at a high level of what appointments you have coming up and what the response action has been, whether it's a confirmation or a cancellation. You can also drill down if you see that Betsy Ross hasn't responded and you want to make sure she got her reminders. You can see there that we did successfully deliver both an email and a text message. Another nice feature of the filter sort is that you could sort for cancellations or people who hadn't responded if you wanted to do one more call that morning to kind of drive attendance to those appointments. So again, we make it really easy to not only deploy the reminder solution, but also track it. In addition to this daily view, you also have a reminder summary view that you can back up and look at a month at a time, what types of reminders did I send and what was the outcome of those reminders, so that if you determine that your population is more responsive to text message, maybe you want to start with 2 text messages and a call instead of one of each. So just a really, really slick feature that you can activate right from the upgraded Updox. From a numbers perspective, the return on reminders is probably one of our most obvious ones. If you think about the typical week in a single provider practice, for every 100 appointments, approximately 7 will no-show for industry average. So if you consider a $20 copay, an average reimbursement of $90, your practice could be losing as much as $41,000 annually, or even $800 a week. Sounds maybe a little bit easier to digest. So what Updox is able to do is cut the instance of those no-shows with our reminders by as much as 30%, which can save the practice $12,500 per provider on an annual basis. In addition to that, staff will no longer be required to spend that time on the phone making those reminders or chasing down those cancellations, which frees up their time to focus on more patient care-centered activities. So our next feature that I wanted to talk through was the on-demand or targeted messaging. So what did this look like before Updox? It looked like the doctor asking you to pick up the phone and call a bunch of people or send a mailed notification probably. Why would they have had you do this? If you had unexpected closures, if you had flu clinics, end of year immunizations, these are just some of the reasons that we see this being used. When you make it so easy to communicate with patients and contacts, though, is when you really think of the other ways that you could use the solution. So if you wanted to send educational content to remain compliant with CMS requirements, so you have everyone who had a cholesterol screening last week, send them a message. If you wanted to send a blast notification to your 4 no-shows to get them back on the schedule, if you wanted to thank patients for coming to see you the previous week or wish them a happy birthday if it's their birthday month. So all of these little things that you can do to engage patients and kind of give them those warm and fuzzies, or things that you can do to kind of leverage the revenue side of that, because you could drive more attendance to your flu clinics or your immunizations and you collect copays on that sort of thing. So all of those different ways that you can use Blast to engage patients. There's also a really great feature in Blast to engage contacts. So if you think about a referral source that you interact with on a monthly basis, if you wanted to send them a message each month thanking them for your business partnership and staying front of mind so that when they do have referrals, they come your way, or the other way around. That's another really common use case for this. Or if you're opening a new location for your practice and you wanted to let nearby potential referral sources know that you'd be there. Another really great use case for the Blast on-demand messaging. What it is to send a Blast is to deliver a message in a quick, convenient, and user-friendly manner, either by phone call, text message, or email, or for Amazing Charts, you can actually use Blast to send portal messages as well. And what it does is it saves you the time that you would obviously spend otherwise calling or putting together those snail mail pieces. Building the Blast is super simple. You choose your method, whether it's email, portal, telephone, or text. You type in, or you select your list. So we do have some canned things here for you, like last however many days appointments, next week's appointments, today's appointments, tomorrow's appointments, that sort of thing. And then we also have birthday filters hand-built. So you'd select a pre-configured list and type in a message and send. Or if you have a little bit more of a creative idea about how to use it, you can actually build custom lists as well by filtering the data inside of the application. So if you wanted to get a little bit more specific than this, you can further filter the data too. Or if you have a really curmudgeon-y patient that you don't want to put a message in front of, you could remove them from the list, or if you have someone that you'd really like to get a message to and you want to compile a list from scratch, you can pick and choose that way too. So that's kind of a quick overview of the targeted messaging solution. And again, that can be used alongside our reminder solution or apart from it if you had another reminder solution in place. The next feature I wanted to talk about is a big one for Amazing Charts because it's the upgraded portal features. So kind of going beyond meaningful use and how you can use the portal not as a kind of pain in the neck requirement, but more as a benefit to your practice to make your days a little bit easier. So thinking through patient communication before Updox, what sorts of pains do we solve? If a patient had a question about follow-up care or concerns that they might have a need for an appointment, they would call the practice, leave a message on the nurse line, the nurse jots down the message, tracks down the doctor, calls the patient back, leaves a voicemail, patient calls nurse back, and fingers crossed you're able to connect to get that quick question answered. What Updox allows you to do is send a quick message to the portal. The patient can review the message, respond to it, and then you could have a dialogue back and forth without chasing each other down by phone. We provide, from a pure features perspective, secure messaging in that capacity, and then we also go beyond that and do patient registration and the ability for them to update their demographics, which syncs, again, with your Amazing Charts. We also offer online scheduling, the ability to take payments through the portal, and custom forms. You can build a full library of custom forms, as many questions as you like, as many forms as you'd like, and host them there to be filled out electronically to get rid of more of that paper in the office. Using it to send messages and such is just as easy as it is to send things into the chart. It's the same universal inbox that you're using when you're faxing and filing, and you have similar fields to when you're sending someone an email. So again, it's intuitive. You have a subject line, you have a message section. If you find that you're saying the same thing over and over again in messages, you can create a template for it. So rather than typing 30 words, you're clicking templates and then choosing a template. So 2 clicks instead of 30 words. A lot of time savings there. What happens when you send a portal message, if they have an email address on file, is that a little note goes out that says, when you, or hey, this practice sent you a message, click here to retrieve it. It directs them to the portal where they securely log in with their username and password. Their username is probably their email address in most instances, and they can review their message and respond. And that is all 100% HIPAA compliant and super easy to use. So our portal is not super complicated, hard to log in, hard to navigate. You have a login button, you have 5 tabs across the top, fewer than that if you don't have all of your features turned on, and it's very obvious for them where to access a message from you and how to respond to it. So once you get them kind of into that portal and using it for messaging, we also have the ability to open up online scheduling if you'd like. So think about the workflow of scheduling an appointment. If a patient calls needing to come in for a potential sick visit, you're having the same game of phone tag where your staff is eventually pulling up a schedule, trying to find a time that works for both you and the patient, and how many times per day are you going through this song and dance where you're trying to find an appropriate time once you've determined that you do in fact need to come in for an appointment. We have the ability to look at your schedule inside of Amazing Charts, and you have the ability to fully customize or tailor how open your schedule is. So talking about online scheduling with Amazing Charts customers, they usually fall into 2 camps. They're either super excited not to spend time on the phone trying to find time for the appointment, and they also see the value of everything being online now, so patients sometimes don't want an appointment with an office if they can't request it online because, you know, kids these days don't want to pick up the phone and call. The other side of the Amazing Charts customer camp is that you're worried about opening up your schedule to a needy patient who maybe wants to book 3 appointments in a row and ties up your schedule for what otherwise would have been a 15-minute appointment. So what you're able to do is pick and choose what days and times you're available for appointments. So even though you're in the office from 9 to 5 Monday through Friday, maybe you just do online scheduling Tuesday afternoons, or maybe just certain appointment types, so just blood draw appointments so that they can't pick sick visits or annual physicals that are going to eat up more time on your schedule. So that way you're giving the impression of online scheduling, which gives patients the warm fuzzies and the convenience of not having to schedule certain types of appointments without opening yourself up to a patient that might ask for too many appointments or an appointment type that you don't want them to have control over asking for. So there's certainly a ton of customization available with that scheduling application, and what it ends up doing for practices that utilize it is freeing up the time that they're otherwise spending on the phone with those patients trying to find a good time. Another really great value add for the upgraded portal is the ability to let patients update their demographic information for you so that you're not doing it. Otherwise, they're arriving at the office, you're giving them their clipboard, they're giving it back. Again, they're stopping taking care of patients for a moment from a care perspective to update the administrative part of it if they have insurance information, or if they're new to your practice, you're typing everything in from scratch to create them. So what Updox makes it really easy to do is access their demographics tab right from within the portal. So before your patient comes in for an appointment, they could update their patient information, their contact, and their insurance information, so that when it comes to you, you're clicking one button to update it inside of Amazing Charts instead of scanning for data entry updates. If it's a patient that you're creating from scratch, again, you can direct them to the portal, have them do the new patient registration button. We're going to collect the exact same information, and it's going to be served to you inside of the Updox inbox, where you can click Create New Patient, and we'll create them inside of Amazing Charts for you. So rather than typing in the, 5, 10, 15, 20 different fields to create a new patient, you're clicking one button to create them inside of the portal account. The last really great feature that you're able to access through the upgraded portal is the ability to take payments. So this is kind of a twofold solution, but we'll start with the portal impact of it. So let's say a patient, if they have a past due balance for you, you would have asked them to write a check to the attention of your practice, or maybe swiped in-house if they're able to make that type of a payment. If they're not able to, or they can't pay at that point in time, you're going to take the time to bill them at a later date, which again means your staff is doing an administrative task there, or you're paying for a biller to do something like that. These days, high deductibles, payment plans are hard to manage. Previously there was not a really great solution that made it easy for you to set this up for patients to submit payments across a few periods of time without having to do it yourself and stay on top of it in a manual way. You also can't direct them to a website. With most of the Square swipers, if you're using that, there's not a counterpart online where they could go in and submit that information to you. So they would either call and give you a credit card over the phone, or they would mail you a check and you'd have to deal with it that way. So what we're able to do is either process the credit cards in office or through the patient portal. So if you need a swiper in-house, we can absolutely help you with that. You can use that swiper to create a credit card on file so that going forward you have something to ding for no-shows or for phone visits, which is what some of our Amazing Charts customers are doing. Or if they wanted to do a payment plan in office, you can swipe that card and put it on file for a payment plan. You also have the ability to direct them to the portal where they can submit payments online through that portal that would come in. If you really want to open it up, you could let them create payment plans for themselves through the portal. I will say that not many people do that, but you do have the ability to lock that back down and only have it in office too. In addition to just paying for things like copays and fees for service, you also have the option to offer products and services that patients can purchase through the portal. So almost like a shopping cart type thing. If you have supplements in office or things of that nature, you're able to use Updox as a mechanism to collect money for that. And it can be used the same thing for like a membership. If you're doing a pay to be a part of the practice type thing where you have an annual membership fee, Updox can be used to take payment for that as well. Accessing the payment application is going to be, again, right inside of that same inbox that we've been talking about all day, the Universal Inbox. You type in your patient's name. We're going to give you their next 5 scheduled payments, their previous 5 payments. It's really easy to do a quick swipe and pay from here. You can see if they have a credit card on file. You can create a payment plan or review their existing payment plans, all from the same window that you're already using for faxing and reminders and the patient portal. So that was a lot of features. We do offer, as I mentioned, a lot across the Amazing Chart space, and it's been a really, really exciting partnership to be a part of, because as these needs have arisen, We have a few great promoters that have been using us for years and years. They're happy to talk to us about what hurts and where and how we can fix it. And so we've had the opportunity to kind of grow as a partner with Amazing Charts to layer in these different solutions. And I do think that some of our more successful customers would tell you that it's because they went beyond just the base level of the meaningful use requirements, or they went just beyond faxing and really started to see the value that the full solution can provide. And that's just kind of an overview here. Hold on one moment. Let me pop into my question slide. Perfect. So getting started, next steps. What if you saw the presentation today, didn't know how much we provide, and then on the 15th day you'd become a paying customer. We charge your card for the first time and then monthly from there. If you do decide before the 15th day that it's not going to be a fit for your practice, we can certainly bring you back down to the free level, or we're able to discontinue your account altogether if you didn't want to get even into the free portal. We do offer free training for all new customers as well. Or if you add on a solution later on. So if you're an existing fax customer, but you're really interested in reminders and blasts or payments, we offer free training on those solutions as well. And we always have unlimited tech support too. And I think we're available 8 to 8 Eastern time currently. I believe Adam's team is going to be following up to see if there are any follow-up questions. If you'd be interested in speaking with anyone on our product expert team over here at Updox, but you're certainly welcome to call us directly as well. And our number and our email address are listed there. And that's my spiel, so I will kick it back to Adam to see if we had any questions.
Thanks, Katie. I appreciate it. We did have a couple questions come in. Getting a quick little bit of feedback from your end, Katie. I'm just going to mute you out while I read the question.
Okay.
Okay, so the first question that I received, I may have missed this, but what happens when a patient cancels the appointment?
Sure. So if a patient cancels the appointment, there's an appointment cancellation notification that shows up right at the top of the Updox inbox. It'll give you the patient's information, the appointment information, so that it's easy for you to send them a quick note to get them rescheduled or reach out with a phone call right away. It does show up right at the top of your inbox, and it's very clearly labeled.
Great. And I had another question. If I sign up for this full service, do I have to change my fax number, or can I keep the one that I'm using now for my patients?
Great question. We get that a lot. So when you become an Updox customer, we do provide a free fax number to all of our customers that you're welcome to use outright. It can be toll-free or local, but what we find is that most practices do have that established fax line, so you can either call forward your existing number to Updox and continue to be able to paper fax out. You'll also be able to electronically fax out, and obviously your faxes will start coming in electronically that way without having to hand out a new number. Or we can port your number over so that we kind of take ownership of it. So rather than, like if you were using AT&T and you wanted to go to Verizon, Verizon ports your number away from AT&T so that you're no longer paying AT&T. We can do the same thing, except that there's no monthly charge for a fax line at Updox. So that's how some people use us, as a way to offset the cost of their fax line and really add efficiency to the amount that they were paying for that on a monthly basis.
Great. And there was one more question here. Somebody asked, can I add one service at a time? Can I start with the fax and then maybe add the reminders later if it works out, for example?
Sure, that's a great question too. We do, it's awesome if you move forward with more than one thing at a time. So if you wanted to do fax and try reminders at the same time, for instance, we're able to do bundled discount pricing. But you can certainly come back if you wanted to try something for a few months and add on later. You can certainly add on to your existing solutions. You just wouldn't have the benefit of the bundled pricing at that point.
Okay, great. That was all the questions that I received. In the case, like I said, if you guys think of any other questions that may not have been covered, or if I missed yours, feel free to reach out directly to either the number listed here, or you can reach out to us at Amazing Charts at 866-382-5932 and press the number directed for sales, and one of our reps would be able to assist you with some questions or connect you with a specialist. If you want to reach out to me directly, it's A. Lombardi, Lombardi, at amazingcharts.com. And let me see, I might have a couple more questions that came in. Give me 1 second. Here's one specifically about payment features. Do the payment features of Updox work if we are not using Amazing Charts Practice Management?
Good question. So we are not actually integrated with the Amazing Charts PM in like a balance due type capacity. So what Updox would make it easy to do is collect payments, but you would still be balancing the books inside of your PM. So if someone submitted a payment through the portal, you'd get an inbox notification that that came through. It would be posted to your account. It would tell you who paid and how much they paid, and then you would hop into the PM and kind of balance the books that way, regardless of whether it was the Amazing Charts PM or another PM. We don't have that, the integration on the PM side.
Great. And I had another couple of questions here for you, Katie, sorry. Can you have more than one fax line with Updox? So could they have a specific fax line for their billing and then a specific fax line for their patient services?
You absolutely can. So initially the first line is included, but what's great about our faxing pricing structure is that additional lines are only $2 per month. So if you wanted to have a second line using a fax or a phone company, they might charge you another 20, 30, 40 bucks for a second line, but with us it's just $2. So if you wanted, we even see sometimes the billing wants their own fax number, maybe a doctor wants a private fax number in addition to the main number. It's really cost efficient to layer in those needs for different fax numbers with Updox because we do make it so cheap.
Okay, great. We had a few more questions come in. Here's one. We currently use a fax server on our large office printer. What would we need to do to enable the fax line?
So we are actually able to partner with fax servers in a lot of instances. If they generate a PDF or a TIFF file, we have a mechanism that can look into that fax server. Like if you're like, take these faxes and write them into this folder as a PDF, we can look at that folder continually and pull any documents into Updox that land in that folder. So what we would do is during training, we would just set you up to look inside of whatever folder your fax server is saving things to.
Okay. And then another one, could you cover a bit of the registration process for new patients to log into the secure messaging?
Sure. So if you invite them through Amazing Charts, I think the easiest thing to do is hop into their demographics inside of Amazing Charts, type in the email address, check the box that says invite to the patient portal, and what that's going to do is send them an email invitation to your portal that they would click to log in for the first time. The value of adding the email address as the first way to get them started is that they'll remember their username at least getting logged in there, and then they can change their password the first time they get logged in so that it's something they remember. But that's as easy as it is to invite a patient to your portal. Would be just inviting them inside of Amazing Charts, or if you didn't want to be the one to invite them, you can just direct them to your patient portal link and have them click the new patient registration button, and that's going to grab contact information and their insurance information. So that way, they're also, again, creating their own username so that they'll remember it, and then you're just accepting them into your portal at that point. So either direction gets you to the same place where your patient has the ability to communicate through the portal.
Great. And I had two more questions come in. These probably everybody's wondering. One of them, somebody asked, can you give us an idea on the bundle cost? Is it X dollars per X number of faxes, et cetera?
Sure. So we do per provider pricing, and that includes 500 fax pages per provider. So if you have a 2-provider practice and one of you faxes more than the other one, you're kind of drawing from the same pile, which is it's a better way for you guys to do that. You're not confined to your own 500 pages inside of that model, and then it would just be $10 per 500 pages beyond that. So if you're a high volume faxing practice, you're probably at maybe 1,000 pages per provider each month. It would only be an additional $10 to get to that volume.
Okay, great. And this one is a little specific on functionality, which I'm sure everybody will be wondering about. Does the fax go directly into the patient chart?
So the faxes come into the Updox inbox, and then you would direct them from there. So if you were to get something that didn't need to go to the chart, it doesn't automatically land in Amazing Chart, so it's kind of nice that it doesn't go directly there. Once it gets to the Updox inbox, you choose which category inside of the imported item section you want it to go to. And then as you're filing, you can also choose to send it as an inbox message to the provider at the same time. So it comes into Updox, and then you send it directly to the chart, sometimes creating an inbox message along the way.
Perfect. Okay, and that was the last of the questions that I received. As I stated, we'll be reaching out to each of you guys that did register for the webinar. So if you do have additional questions, feel free to just jot them down, and when you hear from one of our reps, we can cover the answers to those questions for you, or connect you with one of the specialists at Updox if it's a more detailed or high-level question than my reps here could answer for you. I'd like to thank everybody for joining today. I'd like to thank Katie for the presentation. I know that many of you guys used your lunch break on the East Coast or started your morning with this webinar on the West Coast. So we appreciate your time, and keep an eye out for additional webinars that we'll be running on other services that can help your practice become more efficient.
Thank you so much, everyone.